Hi, and welcome to Med4Care. I am Dr. Care, and today's topic will be Sialorrhea. Let's find out together what it is. Sialorrhea, or excessive salivation, is a clinical condition in which there is an exaggerated increase in saliva production in the oral cavity and is also synonymous with ptyalism. Sialorrhea is common in early childhood. It begins to be considered abnormal from the age of 4 and is often related to the inability of the oral cavity to eliminate the overproduction of saliva. Before continuing with the Sialorrhea, let's deepen the saliva and the role. Saliva is the liquid that is processed, produced, and secreted by the salivary glands, mainly represented by the parotids, submandibular glands, and sublingual glands. The chemical composition of saliva varies according to the type of secretion carried out by the gland, but in any case, it is made up of 98.5% water and to a lesser extent, some ions, proteins, and enzymes. Some enzymes contained in salivary fluid, such as amylase and lipase, help to start the digestion of food, while other enzymes such as lysozyme and peroxidase exert a defensive and antimicrobial action. The importance of lactoferrin, naturally contained in saliva, has also recently been ascertained in being able to bind, retain, and inhibit the aggression of various pathogens, especially viruses. Well, after deepening the saliva, let's go back to the Sialorrhea and let's look at its causes together. Excessive salivation can be caused by a primary excess of saliva production by the salivary glands. Sometimes the persistence of a particular stimuli, such as the introduction of smooth objects into the oral cavity, common in children, can lead to an excessive saliva production in an attempt to lubricate the oral cavity. Some drugs that enhance the activity of the parasympathetic nervous system, example, drugs with cholinergic action, also elicit the stimulation and production of saliva by the various salivary glands. In this case, excessive salivation resulted from the inability of the oropharyngeal system to provide optimal swallowing. Since salivary secretion is regulated by nerve signals that lead to the urge of the salivary glands to contract and secrete saliva, a contraction dysenergy can lead to secretion deficiency or swallowing deficiency. If some involuntary muscles of the pharynx do not receive the signal to contract properly, saliva tends to accumulate in the oral cavity without being able to be swallowed, with the danger of suffocation of the upper airways. In adults, one of the most common causes of drooling is represented by the degeneration of nerve signals induced by stroke and Parkinson's disease. In Parkinson's, Sialorrhea often manifests itself as an extrusion of drool from the corners of the lips, both at rest and when trying to speak, and is determined by the inability of these patients to swallow optimally, so saliva tends to slip out of the mouth. The correct evaluation of the excessive production of saliva and the search for the causes that determine it are generally entrusted to the specialist otolaryngologist or to the maxillofacial surgeon. The anamnesis is of considerable importance. After investigating the general state of health and the medications taken in case of therapies, the doctor proceeds to ask the patient questions to better frame his condition, such as the amount of saliva normally present and if there are particular difficulties in swallowing certain types of food. Once the anamnestic phase has been completed, we move on to the physical examination, where the doctor examines and inspects the oral cavity with the aim of looking for any deformations, trauma, or obstructions affecting the various salivary glands. If deemed appropriate, it is also possible to evaluate the function of each single major salivary gland using special very thin catheters which evaluate the salivary flow rate. In addition to blood tests, which are routinely prescribed to investigate the general state of the patient, a chemical, physical, and microbiological analysis of the salivary fluid is often conducted, looking for specific alterations or infections by bacteria that may have colonized the mouth. The treatments available for the treatment of Sialorrhea can initially be of a conservative nature and are managed by a group of speech therapists, occupational therapists, and neurologists, and are based on the correct postural education of the muscles of the oral cavity or on biofeedback techniques. More often, some drugs are commonly used to attenuate the exuberant production of saliva and act by counteracting the impulse of the parasympathetic nervous system, such as scopolamine and glycopyrrolate. The treatment that proves most decisive in the treatment and correction of Sialorrhea, however, is represented by surgery, which can directly excise the salivary glands, tie the ducts that carry the liquid, or redirect the liquid itself to a more appropriate anatomical position. Finally, it is good to remember, regardless of the cause, excessive salivation causes a series of physical complications and social discomfort for the patient, including the strong social stigma and embarrassment to lead a satisfying relationship life. Fortunately, excess salivation can be effectively controlled by conservative therapies and pharmacological therapies, and in more complex cases, even by decisive surgical interventions which attenuate or completely cancel salivary retention. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon in Med4Care!